in patients who have a confirmed diagnosis of group 4 CTEPH, which generally involves imaging studies such as a VQ scan and right heart catheterization to document the pulmonary hypertension, a review of whether or not the patient is eligible for curative surgery, pulmonary thromboendarterectomy, is a paramount first-order priority business. We do that in a multidisciplinary conference with cardiology, pulmonary, anesthesiology, critical care, chest radiology, cardiothoracic surgery to review all of the tests that the patient has had. And if they're eligible for surgery and they undergo a pulmonary thromboendarterectomy, 85% of the time it's curative. About 10% of the time the pulmonary hypertension may be persistent but is much improved, and there can be some significant complications in somewhere 5% or lower of the cases. But it's very important to determine whether a patient might be eligible for that surgery and offer the surgery if they are eligible. If they are not eligible for that surgery, either because of the anatomy of the blockage or maybe they have multiple other illnesses that wouldn't make them a good candidate for a major surgery, then consideration for treatment with riociguat, which is the only FDA-approved medication for inoperable CTEPH, is the next order of business. That medication is generally started at a low dose and titrated upward to its maximal dose over several weeks, and then a reassessment of the patient as to how well they're doing. They also almost always, I can't really think of an exception, quite frankly, require lifelong anticoagulation. The only exception would be if they just cannot tolerate it because they would have bleeding episodes on the anticoagulation. But even those patients we've been generally able to manage in different ways with different anticoagulants or different ways of protecting the patient. Lastly, because they have some stress on the heart, they may need medications to help manage fluid retention. Those are usually diuretics, for example. And then oxygen therapy if that's an issue.
The OPUS registry was a long-term, prospective, multi-center, United States-based registry of patients who were newly started on macitentan. It's a real-world registry describing real-world use of macitentan in the United States. They recently published their outcomes of patients treated with macitentan for chronic thromboembolic pulmonary hypertension. What they found is about 28% of patients were treated with macitentan as monotherapy in chronic thromboembolic pulmonary hypertension, and the majority, about 70% of patients, were treated with macitentan in dual combination therapy, most commonly in addition to riociguat. This provided some real-world data regarding macitentan and described it as being relatively well-tolerated in patients with chronic thromboembolic pulmonary hypertension and in patients who were treated with riociguat in addition to macitentan for CTEPH.